When human beings come into contact with bats, either directly or indirectly, the virus may accidentally jump into man. The virus can cause a severe form of brain infection or a pneumonia, both of which carry a very high fatality rate. Sometimes the diagnosis of Nipah can be missed because it is not specifically tested for. The problem with Nipah is that it can also spread from patient to patient. So it's extremely important to identify the first patient. The Nipah virus circulates freely among bats and they don't seem to die from it. But when human beings come into contact with bats, either directly or indirectly, the virus may accidentally jump into man. The virus can cause a severe form of brain infection or a pneumonia, both of which carry a very high fatality rate. The death rate from Nipah can range from 73% to 91%. The initial symptoms are fever, body ache, headache, but in people who develop brain infection after that, they may get seizures or epilepsy, confusion, paralysis, or coma. The symptoms are similar to other types of brain infection caused by other viruses. Sometimes the diagnosis of Nipah can be missed because it is not specifically tested for. The problem with Nipah is that it can also spread from patient to patient. So it's extremely important to identify the first patient who develops the infection. Unfortunately, in many cases, the first patient is either very ill or may have died by the time the diagnosis is ascertained, which means this person may have passed on this virus to other people. And these other people, if they develop symptoms like cough, vomiting, or seizures and get admitted to a hospital, sometimes people who treat this person, like nurses or doctors or other hospital staff, may also get infected. Other caregivers at the patient's home who tend to the patient's body fluids can also get infected. Therefore, it is extremely important, one, to make an early diagnosis, two, to isolate a patient, and three, to treat the patient with standard precautions such as masks and gloves. Even more important is to track the contacts of these patients because Nipah virus can jump from person to person and can cause a potentially fatal infection, which is why contact tracing is of great value in limiting the size of the outbreak. Fortunately, unlike COVID, Nipah does not have the ability to spread fast from person to person. Typically, it occurs through very close bodily contact or by handling the person's body fluids or exposure to the person's body fluids. Unfortunately, Nipah virus has no effective antiviral treatment or vaccine that are available. Therefore, the treatment measures are only supportive, and it is extremely important to limit the size of the outbreak, prevent the virus from spreading far and wide to many people. This is why contact tracing is so valuable. Nipah is one of several viruses that may accidentally jump from animals to man, and this category of disease is called a zoonosis. A common zoonosis that we are all familiar with is rabies. It commonly circulates in wild foxes that may come into contact with dogs while searching for food in the border areas of the jungle. And these viruses circulate in stray dogs, and they can also jump onto pet cats and pet dogs, especially if they are not vaccinated. Rabies virus jumps to human beings as a result of a dog bite. And if first aid and vaccination is not administered, the person may go on to develop rabies, and if the person develops rabies,